I think prudent healthcare is going to be a big change, really, or it's not going to work. This is not about minor adaptations to business as usual. This is really about two things. It's about making sure that we do things right, and it's about making sure we do the right things. Now, we're quite used to redesigning services to be more efficient, and this prudent healthcare is about more of that. The doing the right things bit, though, is a radical change. This is about genuinely being open to the possibility that no intervention is better than some intervention, or that intervention that isn't medical is what actually contributes to patients' outcomes. So that is a different way of thinking. That's big change.
I think prudent healthcare offers really a new mandate for people offering NHS services and receiving them, because it really focuses back on why are we seeking care, what's it for, what's the balance between risk and benefit, and is this really what people want?
I think one of the issues in the health service is that it's a huge sort of bureaucratic organisation that lumbers along in very much the same way as it did 40 or 50 years ago. And so much has changed. Medical practice has changed, medical treatments have changed, and the demographic of patients has changed. So doing things in the same way that we've always done is perhaps not the brightest way to go forward. And I think a lot more thought and coordinated thought needs to be given as to how we can develop a service that actually manages to get patients the treatment that they need in a manner that they find acceptable and that they agree to, whilst at the same time making sure they are not harmed in any way, and that the system that is actually devised allows the professionals to behave in a professional manner to the patients, rather than actually obstruct those clinicians from doing what they know is best for their patients.
The conversation needs to have its starting point in a different place, with the question of what do you want as a patient, as a user of these services, rather than thinking of people as diagnosis or looking at their particular condition. We need to be much cleverer at making all that science and that we use to make decisions understandable, and that's quite tough to do, and we're going to have to work really, really hard at making all that information available in such a way that patients can join in the conversation and actually actively participate in the choices that ultimately are about their lives.
I think prudent healthcare isn't a goal that you reach and you say, we've done it. Prudent healthcare is always receding away from you, because you can always do more. That's the nature of healthcare anyway, isn't it? You never reach perfection. Perfection is always unattainable, but you still aim for it. So we still aim to be more prudent. But we will see, I think, a qualitative change in the way in which patients engage with their healthcare. So they'll be getting a range of stuff that actually focuses more on their outcomes. I think also we'll see a greater transparency around all of this. So we will know whether patients are better off, they are getting what they want 1, 2 years after the intervention. That's what we will be interested in. That will be the currency, not how many operations did we do last year, how long was the waiting list, because neither of those really are very good measures of a good health service.
I think prudent healthcare is a concept of doing things in an efficient way and devising systems that will actually support both healthcare professionals and people working in the service to provide the best care for patients, a safe care for patients, and an efficient care for patients.